So namaste to all of you. Today we are live, and today there is a program in which our today's guest speaker is Dr. K. Anuradha, who is a consultant in Vaidoli Ayurveda Center, Trichy. And just we start this session after uh, just Dhanvantari Vandana. Just after Dhanvantari Vandana, we will start this session. So stay with us and just 5 minutes.
नमामि धन्वन्तरिमादिदेवं सुरासुरैः वन्दितपादपद्मं लोके जरामृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
कोई भी सपना साकार करने के लिए सबसे जरूरी है सही कोच का होना। चुनिए आयुष दर्पण डिजिटल को और करे अपने क्लिनिकल आयुर्वेद सीखने का सपना साकार। डाउनलोड द ऐप नाउ।
So Anuradha ji, welcome to Ayush Darpan platform, and we are now live. So you can start your presentation, and after that, I will give you a vote of thanks to you also. Thank you. Namaste. So you can share your screen.
I hope my screen is visible, right?
Yeah, it's visible.
Yeah. Good evening, namaste to everyone. Special thanks to Naveen sir for this wonderful opportunity. I'm Dr. Anuradha. I'm a postgraduate in Panchakarma. Right now, I am in Chennai. I'm the founder of Rajashri Ayurvedics, and I do practice Panchakarma specifically in my own clinic in Chennai. So here I'm going to give you the basic concepts and practical applications of Vaman Karma. Okay. Right from the etiology, just for your brushing up, it's derived from the term Vamana, which is derived from Vam Dhatu and Lut Pratyaya, or Vam Udgirani, Doshaharana Urdhva Bhaga. Anything that expels out Urdhva Bhaga, dosha in generally comes under the term as Vamana. So here specifically only Apakwa doshas are coming out, only Apakwa Pitta and Apakwa Kapha. See, imagine it doesn't go below the stomach. We are consistent in Vamana with only the Urdhva Bhaga Harana. So it can never undergo digestion. So always Apakwa Pitta and Apakwa Kapha Harana from the Amarshya is the term, procedure term Vamana. So actually, when can you perform Vamana? The criteria, Acharya Charaka says, तानि उपस्थितदोषाणां स्नेहस्वेदोपपादनैः पञ्चकर्माणि कुर्वीत मात्रा कालौ विचारयन्. So upasthita is a stage where the doshas are detached from shakha and driven to the koshta. So we know that due to so much other factors, the doshas are prevailing in the shakha. Shakha can be like all the rasadi dhatus, or even shaka directly we consider it as extremities. So from there we'll have to bring it to the koshta from where it can expel out. From nearby marga, that is why upasthita, which is like nearby marga from the stomach is obviously mouth. That is why upasthita is a stage where shaka, from the shaka, the doshas have come to koshta, and from there you are trying to expel out. How can you expel out? With the help of sneha sweda as a purva karma, which will help in bringing this doshas into a utklesha stage. A lena dosha can never be detoxified. Lena dosha, if you try to detoxify, Acharya gives a simile as ripe, unripened mango. If you are trying to squeeze, it is going to lead to ashraya nasha. So we cannot bring up a lena dosha. To make sure it is undergoing vamana, it has to come to a stage of utkleshana. To bring this utkleshana, detaching completely from the shotas, you need the help of both sneha and sweta, where you will have the koshta brought to the koshta, doshas brought to koshta as well, right? So vamana as a ritu shodhana also we do. Generally in Hemanta and Shishira, the Kapha Chaya stage happens. So in Vasanta Ritu, due to Surya Kirana Prabhava, the Kapha gets more liquefied, where actually you get this Vilayana Rupam. Obviously, our Agni will also be done down in nature. All Kapha generated Vikaras will be there. So we will be advising them as a Ritu Shodhana, the mild Vamana procedure. Whereas coming to very specific condition, so kapha in swasthana, if it is aggravated, you will get tamaka shwasa. So there again, vamana is a first hand of treatment. Then obviously virechana. Again, pitta mixed kapha. Big example is amla pitta. Pitta vardhaga in kaphasthana in unmada jwara cases, and pitta vata aggravation in kapasthana like madhyatya. And other than these all kaphaja nanatmaja vikaras mentioned, you can do vamana. So in common practice, we do vamana in PCOD, chronic sinusitis, which can be due to aggravated kapha, GERD, amlapitta, chronic, and again chronic skin diseases and multiple types of psoriasis, rhinitis, and second prameha to an extent, diabetes mellitus 2, provided considering the age factor. For not all prameha you can do, considering the age factor, and if it is genetic or not, ruling out all these, you can adopt vamana. And in psychiatric disorders, where even in unmada, first hand of treatment for kaphaja unmada, you get it. In schizophrenia, depression, vamana is a good option to go with. Sthaulya, obesity, and COPD, kind of repeated lower respiratory tract infections, and thyroid disorders. So there are few areas where you can do sadhya vamana without the purva karma. So already the doshas are in utklesha condition, so you cannot wait. It's an emergency condition where you need to do sadhya vamana. So the condition is the dosha has already attained in in a state of bahudosha level. So there is no time for purva karma, and they are already in the amasya, in the utklesha stage. The first mentioned sadhya vamana is in Charaka Samhita Siddhisthana, Trikukshya Madhyayam, where tatra sadhya mamam pradushtam amam alasi bhudam ullekeyet adav payetva salavanam ushnavari. So in the cases where alasi bhuda ama is already there, chronic stage, acute stage of food poisoning, and in other cases like Navajara, Shwasa, Ajirna, Visha, etc., there is no time for Purva Karma. The first hand of choice would be Sadhya Vamana. Few logic behind the principles of Vamana which we execute. So as a Purva Karma, we mentioned to bring the stage of Utklesha and to bring the doshas to Koshta. So the lakshanas are, the dosha should be in the vriddhi avastha. Vridhya, vishyantana, pak, dosha paka, shrotomukha vishodhana and vayu nigrahana. So sneha and sweta brings up these qualities. It brings up vriddhi, it brings up the vilena rupa vriddhi of the doshas. It brings the dosha into paka stage, not in the ama stage. Coming to complete Shrodha Mukha Vishodhana and Vayu Harana. For this case, we have to do Purva Karma. So after Purva Karma, there is one day Vishrama Kala mentioned for Vamana Kriya. So after a tiresome Arohana Krama Snehapana, to prepare for further purification, it is something reverse peristalsis you are giving to the body, which is again a strain. So to make sure you have the energy level to sustain the whole procedure of Vamana, you need a gap of 1 day. And also to maintain the same stage of Utklesha, which is caused by the ghee intake, you need to again give on the same day the Masha preparations only. If you avoid this Masha preparation eating on the day of Vishrama Kala, there are chances that you can wind up in reducing Kapha stage and increasing Pitta stage, where actually Vamana cannot happen, right? So Masha preparations like Masha Payasa, Idli kind of things, even curd rice, dahi preparations, steamed fish. Again, it's not fried, it's steamed fish. Kshira, all kind of preparations with kshira. Obviously, you need a proper sleep at night. Otherwise, Vata Kopa will happen next morning. You cannot expect a proper Vamana. And morning when you get up also, you should have a proper Vega Udirana passing entrance. And this all only will make sure the Vamana can be successful and giving a proper Vegas. So during the procedure, the first thing to adopt is after the Purva Karma, Yavagupana. So why this Yavagu is mentioned, it helps in actually closing of the pyloric sphincter. Only if the pyloric sphincter is closed, the food stays in stomach. Again, further whatever you can give is going to make the peripheral emetic center and central emetic center work much easier. Okay, so that is the purpose of giving Yavagupana. Next step is Akhandapana. So Akhandapana gives in actually distension of the stomach. So distension is even when we do practically Vamana, we use this tape and measure the abdomen circumference. We can literally see the difference giving the abdominal distension when you have the Akhandapana, which is again a mechanical stimulation for the emetic center to act. Again, then comes the main important thing. The pradhana thing is administration of Vamana Aushadha. And Vamana Aushadha will be chosen specific to the disease. In Charaka Kalpasthana, we have so much mentions of huge of drugs. So depending on the condition, the drugs will be selected. And the selected drug should have the quality of all Vamana drugs has a quality of Ushna, Tikshna, Vyavahi and Vikashi Gunas, which can only help in producing the Vamana Vega. So in between, even if the Vegas are happening, in between there will be Kashaya given or HT Fanda generally used, very rarely to provocate the Vega, Vaja can be added. So why this Kashaya intake is advised? During the initial bouts of Vamana, so only contents up to pyloric antrum will be expelled out. So further, if you keep on inducing Vamana, you will have a negative osmotic gradient generated in the whole GAT. So administration of HT Kashaya, when you keep giving it, it is going to create a positive osmotic gradient towards the whole lumen. So both these pressures forcefully help in extraction of the substances which are easily detachable, which are like Utklishta dosha. Away from the Shrotas is what they mean as away from the substances cells from the lumen. So even if you have consumed excess amount of Snehapana during the Aravana Krama stage of Snehapana consumption, even that fat will be expelled through this procedure. That is the purpose of giving Kashaya. So you keep giving all these things. When to stop? When to stop Vamana? So repeated emesis again causes a generation of negative pressure gradient towards the second part. Initially, it was still the pyloric antrum. Now it again, if you keep on giving, it creates a negative pressure towards the Second part of duodenum, in fact, the small intestine. So again, bile duct, pancreatic duct, they start opening into the ampulla of water, releasing the bile. So this repeated negative pressure is going to give some kind of forcefully expulsion of the bile generated. That is why Pittanta is the Lakshana mentioned in classical text to stop Vamana, not Kafanta. Kapha is all coming out. Uski baad, you have the Pittanta. Then that is the time where you have to stop Vamana. Further, we cannot proceed. After the procedure of Vamana, the next Paschat Karma mentioned here is obviously during the procedure itself on the room, you should give Kabala and then Shita Jala for Prakshalana completely so that further Vega doesn't occur. And Ushna Jala will be used for arms, extremities, hand washing. Then Dhumapana will be given immediately after. In case if there is any kapha left out in the Urdhva Bhaga, so through Dhumapana it helps in expelling out so that no further nose block kind of things happens future. So beyond this, we have the major Paschat Karma is Samsarjana Karma, introducing gradually the diet. So we know carbohydrates and fats, they are the energy stores in the body, but they cannot be hugely administered because already the Agni is down after the procedure of Vamana. We have disturbed the Agni also here. So to start with, Shukadanyas are given in the form of Peya. They require very minimum hydrochloric acid compared to the solid food to digest. So Agni, Alpa Agni is there. So start with Peya with more fluid and very less. Peya is so much of Drava only will be there in Peya. Then next comes to Vilepi, which is a stage where you have a little semi-solid kind of gruel prepared. And this will require more digestive enzymes when compared to the Peya. So next introducing Vilepi. Then again comes to Yusha where you are going to introduce protein, Shimbi Dhanya first. But again, it is without fat and spice. A group of people says without fat and spice. Some group of people say you can start adding little tampering where you can use ghee also. So it is always best to start introducing very mild protein and then to fat. Then finally, when you start adding fat, then that stimulates the bile secretion. For the sake of digestion of fat, obviously the bile secretion would be stimulated. Hence, slowly the digestion process happens and the digestive enzymes are coming into the normal metabolic state. That is why the krama of Peya, Vilepi, then introducing Yusha, finally the Mamsarasa is what advised in the classic texts. So, simple logic behind this, in the serial, if you see, lysine is not present and it is compensated by rich amount of lysine, which will be introduced when you introduce Yusha, the proteins. So rich amount of methionine in cereal compensates lack of methionine in pulses. So both will be compensated when you come to the stage of Yusha. And finally, the protein-rich Mamsarasa, when you introduce, which needs more hydrochloric acid to denature it. And all the three major components are gradually put into the body. That is the logic behind Peyadikarma. So in current scenario, we use Vamana in specific conditions as mentioned earlier, like in chronic skin disease, depression kind of disorders, thyroid dysfunction, chronic asthma condition, again, Staulia, PCOS, infertility, severe acidity, such cases. So basic condition in common respiratory disease like asthma, COPD, bronchiectasis and all. Usually histamines are released due to antigen interaction with IgE antibody. So Vamana acts on the bronchial smooth muscle. It accounts for the high allergic response in the body. That is how Vamana helps in Shwasa. For the case of Tamaka Shwasa, again, above Vamana, Virechana has to be given, otherwise exclusive result with Vamana we cannot predict. For Tamaka, Virechana is a good choice of Panchakarma. So we know Uras is already a Kaphasthana and Shwasa is like Kapha vitiated in Swasthana. Again, there Vamana is a good choice to go with, and it removes all the toxins from the respiratory tract. And the histamines are washed out. Instead, giving repeated antihistamines, one-time detoxification would be of very great help. It also stabilizes further histamine production mechanism in the body. So, if we had already undergone Ritushodhana regularly, such kind of Aupasargika Vyadhi, which is mostly affecting the respiratory tract, would have the percentage of affected people would have come down, probably. So, in Kushta, in deep skin diseases, there will be a molecular level inflammation. So, soluble antigen antibody complex will always be formed. That is a difference between a normal skin and a psoriatic skin. So there again, Vamana helps. So repeated Shodhana is what help, not exclusively Vamana. Pakshe Vamanam, Mase Virejanam is what advice. Every fortnight Vamanam is what to be advised, because the level of the dhatu and dosha, dushana is very, very severe. It is very depth. That is why repeated Shodhanas are advised. So, stoka nirharana is what Acharya Chakrapani says, which is like alpa only you can take out the dosha from a Kushta Rogi, not in one shot. So, if at a time Prabhuda Shodhana is done, even the bala of the patient may get too much deteriorated, chances of Vata Prakopa is very, very high. So, repeated Vamana only can help in clearing the antigen antibody complex formed in the molecular level for a Kushta Rogi. So, Vamana in Staulya, we know basically Medo Dhatu is excessively formed, further Dhatus are not properly formed in Staulya Rogi. So, basically the imbalance of energy intake and the expenditure. They take much, but they do not, exhaust the same level of energy what they have intaken, which leads to Staulya, and it's a sedentary lifestyle disorder right now. It's very clearly mentioned under the Lakshanas of Bahudosha in Charaka Samhita, and involved dosha is kapha and Meda Avrata Vata. Here the selection of Snehapana is mostly Thaila, because Thaila is both Vatahara and does not increase kapha, because when you select ghee, the chances of increasing kapha is high. So to avoid that, as it is already a Meda Avrana, kapha and Meda are having Ashray Benda, so it is better to go with Taila Snehapana in case if you opt for Shodhana in Staulya. In Manovikaras, so there are so many different opinions regarding the sthana of Manas in the classics. So generally, Manovikaras are always associated with lethargy, Gaurava, Alasya, kind of Tamoguna aggravated situations. So better Shodhana therapy is indicated, because the benefit of Shodhana even starts saying Buddhi Prasadam Balam Indriyanam. So Buddhi Prasada is going to be very, very helpful by improving the Manovaha Shotas. So Tamoguna Vardhaka can be reduced when you do Vamana, and definitely the mind refreshing and regains memory. So in addition to it, Vamana cannot be the exclusive solution. In addition to it, other holistic support like other therapies, in addition to it, should be go hand in hand. But the topmost priority should be Vamana. And in the stressful world, as of now, it is always good to adopt Vamana as a Ritu Shodhana to sustain our mental health. In PCOD, usually the hormonal imbalance affecting the follicular growth happens during the ovarian cycle. So the affected follicle always remains immature. So you cannot expect a healthy ovum out of it. That is how multiple cysts are formed. So many causes of infertility comes with the history of PCOD in female. So considering this as a Agni Vaishamya Janya Vyadhi, and Rasadhatu Agni, Medodhatu Agni, Mandya has happened, and it can be due to the aggravation of both Kapha and Vata. If Virechana is adopted, there will be Pitta-kshaya. So obviously Artava-kshaya can happen. So it is better to go for Sadhya Vamana, at least in the form of Sadhya Vamana, and then go for Virechana if the condition demands. Not directly choosing Virechana as a first hand would be the best thing in PCOS. In thyroid disorders, generally, deficiency of thyroid hormone results in generalized slowing of the metabolism. So, kapha plays a very major role in hypothyroidism, because diminished BMR, basal metabolic rate, is absolutely down. Agni is down. So that is why we have the salient features of hirsutism, weight gain, puffy face, breathlessness, etc., which all represents the Bahudosha Lakshana. So Vamana in Amlapita, commonly seen in gastritis, GERD peptic ulcer, where you have the Utklishta Apakwa Pitta Avastha. That is the first line of treatment. It is always better to opt for Vamana. And it is a Kapha Anubandha, but Pitta Pradhana Vyadhi. In the context of Samyak Vamana Lakshana, as already mentioned, Pittanta is told, but this does not indicate the Pitta coming under Amla Pitta. So in Amla Pitta cases, sometimes in the first bout itself, bile can come out, but it doesn't indicate the Pittanta Lakshana. Depending on the condition, we can continue the further procedure of Vamana inducing Vegas. So adopting Shamana therapy of Pitta Dravya after Shodhana would be the best protocol for an Amla Pitta condition. So Vamana helps in promotion of health and in the prevention of disease for a swastha person. Evam vishuddha koshtasya kayagner abhivardate vyadayascha upashamyanti prakritischa anuvartate. So after a koshta gets vishuddha, their kayagni gets abhivardana. So obviously the basal metabolic rate increases. Pradhana vyadi for which you focused on gets upashama. And prakriti, the nature of that specific individual will be coming out. And indriyani mano buddhi varnascha asya prasidadi. So the prasada of the sense organs, mind and intellectual. There can be even improvement in IQ post the detoxification. And balam pushti apathyam cha vrishata cha asya jayate. So it is even mentioned in the factor that fertility can be improved. That's why this benefits are not exclusively for Vamana, for both Virejana and Vamana. We have seen Virejana helps in Bija Shuddhi for helping the Bija Karamugada also Virejana helps. So this benefit applies for both Vamana and Virejana. And Jaram Krichrena Labhate. So we don't get easily aged if we are repeatedly following at least the procedure of Ritu Shodhana for Swastha and Vyadhi Avastha, selecting Vamana or Virechana according to the Vyadhi Avastha. Chiram Jivati Anamaya, the life longevity of the life of an individual can be improved. So Tasmat Samshodhanam Kale Yukti Yuktam Pibetara. That is why it is always best to adopt Samshodhana. So Shodhana in body. Ashtanga Hridaya mentions it as na purarudbhava as a benefit of Shodhana, because once you even adopt the other Kriyakramas, the chances of recurring of disease or relapsing is very common. But when you adopt Shodhana, when you completely detox and remove it from the root cause is identified and you go for the treatment with the root cause and then the Shamana therapy, then Punarudbhava of this specific disease cannot happen. That is a benefit of Shodhana. Thank you. Hello.
Yes, doctor. Yeah. So very nice presentation, doctor. So thank you. Thanks a lot. And so we wish you that every participant who watched this video, they can comments on the comment section regarding any questions. So we will forward to our speaker and she will give you the answer. So thank you, Dr. Saab. Thank you.
Thank you, sir.
And namaste. Thank you.